Good evening and welcome to Downing Street for today's coronavirus briefing. And I'm joined today by Professor Steve Powis, the Medical Director of NHS England, and by Dr. Susan Hopkins, the Chief Medical Advisor to Public Health England and NHS Test and Trace. And I want to bring you up to date with the latest data on the disease and on our vaccine plan in order to combat it. Today, 37,535 positive cases of coronavirus were recorded. The NHS is under significant pressure in all parts of the country. There are 37,475 people in UK hospitals with coronavirus. That is the highest that it's been throughout the pandemic. And someone is admitted to hospital every 30 seconds. And sadly, today 599 more deaths were recorded. That's 599 more people who've died from this terrible disease and left loved ones and their families in mourning. And I know the pain that this disease causes. And I'm determined to do everything we possibly can to defeat it. And I know that that is what you want too. And our vaccine delivery plan is absolutely at the core of this. It is our way out. It's also the biggest medical deployment in British history. And it's one of the biggest civilian operations that this country's ever undertaken. Our approach, of course, is to save as many lives as possible, as quickly as possible, and to reduce the pressure on the NHS. We're on track to deliver our plan to vaccinate the most vulnerable groups by the middle of February, the groups that account for 88% of COVID deaths. And I'm very glad to report that as of midnight last night, we have now vaccinated 4,062,501 people across the United Kingdom. And we're currently vaccinating more than double the rate per person per day than any other country in Europe. Latest data show that we've now vaccinated more than half of those over 80, as well as half of our elderly care home residents. And we all know that these are the groups who are most vulnerable to COVID. And we know that every jab counts. And I'm really pleased that we've been able to meet this milestone. Some areas of the country have done even better. There are some parts where the vast majority of octogenarians have been vaccinated, and there are some places, for instance Slough, who have vaccinated all of their care home residents. And so I want to thank all those who've been doing this enormous task, and in particular Slough and other places around the country who have reached the critical goal of making sure that everybody in a care home can be vaccinated. And this means that in those areas where the vast majority of people in the top 2 priority groups have been vaccinated, from today, we can start moving on to the over 70s and those under 70 who are clinically extremely vulnerable. We're doing this because it's the best way both to maximize the pace of the rollout and to deliver according to the clinical prioritization, all with the goal of saving as many lives as possible, as quickly as possible, and reducing the pressures on the NHS. And I want to say to anybody who is aged over 80 but hasn't yet had their jab, I want to say we will reach you. The NHS will contact you, and you will have your invitation to be vaccinated within the next 4 weeks. And I'm absolutely determined to do all that I possibly can to support people in care homes while we get this vaccination done as soon as possible. Over the weekend, I announced £120 million to support staffing levels in social care. And that's in addition to the £149 million we recently made available to support the regular staff testing in care homes. And I want to thank everyone working in social care for the incredible way that you've stepped up for those who you care for. You make us all proud. And I know that as we continue to live under these difficult restrictions, People want to know the way forward for everyone. Our vaccine programme continues to accelerate and expand, and another 10 large-scale vaccination centres came on stream in England just this morning. But in the meantime, we must all continue to play our part. We must stay at home wherever possible and take vital steps like the basics of hands, face and space, letting fresh air in and keeping to the rules on social distancing. Don't blow it now. We're on the route out. We're protecting the most vulnerable. We're getting the virus under control. Together, I know that we can do it, and we've got to stick at it. And especially with our plans for all adults in the UK to be offered a COVID vaccine by September. And just before I end, I want to say this. There are many more ways that everybody can help in this great national effort. Of course, following the rules is the single most important thing that people can do. But more formally, people are helping by being a community volunteer or signing up for clinical trials for vaccines and for therapeutics, or the 50,000 people who've now signed up for the Sun's Jabs Army, smashing the target in the battle against this disease. And I want to thank each and every one of you and the Sun newspaper for leading in this part of the national effort. But also informally too. And this is something that I know so many people are doing in every part of the country, and I see it every day, and people talk to me about it all of the time. And it really inspires me how people are helping in adversity. Like a grandson helping their grandma to book an appointment online, or neighbours dropping off essentials on the doorstep, or the community groups that are getting together to help drive people to a vaccination centre so that people can get that all-important jab. I find it really heartening at the kind actions that we're seeing from so many people, especially when people need help. So thank you for all that you're doing for your loved ones, for your communities, for your friends and colleagues and neighbours. Being there for each other is so important in these difficult days. And in that spirit, that can help us all get to the brighter times that I know are ahead. Thank you for watching so far. And now we're going to turn straight to the questions, firstly from members of the public. And the first question is from Amanda from Stourbridge by video.
With the alarming increase in hospital admissions and casualties from the virus, what are the plans to protect those working on the front line, for example,
number of weeks, and we will continue to roll them out rapidly as an additional tool to help us get this virus under control.
Thanks. And critically, there are now local lateral flow testing sites that you can go to, that you can walk in asymptomatically without booking. So if you are in one of those groups working on the front line and your employer doesn't do it, you can now go and get a test asymptomatically. And on the NHS pressures, can you give us an update, please, Steve?
Yes, thank you. And Amanda, as you said, as case rates have started to increase over the last month or so, we have seen increasing pressure on the NHS and many, many more people coming into hospital beds. So since Christmas Eve, around 15,000 people have been admitted with coronavirus into our hospitals, and that is well over 20 hospitals worth of new patients. Magnificently, the good news is that the treatments are now better and fewer people are having to be treated in our intensive care units, but nevertheless we are seeing extreme pressure, more than we've ever seen before, more than the first peak in both our general beds and also in our intensive care unit beds. So it is absolutely critical that we continue to stick to those social distancing rules that are in place, that we don't rely yet on vaccines coming to our rescue. It will be some time before the effects of the vaccination programme are seen through into reducing pressure on hospitals. So we all have a role to play in reducing the risk of transmission and taking the pressure off our hospitals. And of course, the final thing I'd say is, on behalf of NHS workers, a huge thanks to our colleagues in education, the teachers who've been looking after the children of our NHS staff, the supermarkets who've assisted in our NHS staff making sure that they can get their groceries and necessities for home. We really value that, but we will continue to do what we've always done and treat everybody who needs care.
Thanks very much indeed. The next question is from Josh from Newcastle. And the question is, how much would it matter if there were a high surge of cases amongst young people if vulnerable groups were protected by the vaccine? Well, thank you for this question. It is incredibly important, and it's one that we think hard about. The most difficult question that we don't yet have an answer to is how much the vaccine protects the most vulnerable groups, not just from catching COVID, but also from serious disease and the degree of transmission that you get from people who have caught COVID. But of course, it's not just the most vulnerable, those in the top 4 priority groups, who do consist of the vast majority of deaths, 88% of deaths. But for hospitalizations, younger people are more likely than that to end up in hospital.
State. There are regional variations in the vaccine, according to some reports, although the overall numbers are encouraging. What do you say to local teams who say they can't get a hold of enough doses?
Well, you're right that there are parts of the country that have made very significant progress and gone a bit faster than the average. And I thank them and congratulate them, places like Slough that I mentioned in my comments. What we're doing now is making sure that whilst they, of course, will be able to move on to the next group, we're prioritising the supply of the vaccine into those parts of the country that need to complete the over 80s. But we don't want to stop the areas that have effectively done that job already. We want them to carry on. But the priority for the vaccine is according to the JCVI prioritisation list. So as I said in my remarks, if you're over 80, wherever you are in the country, you will be invited by the NHS over the next 4 weeks, and hopefully sooner rather than later. In fact, when I was on my way to the press conference here, I got an email from a friend and constituent saying that he'd just got his email this morning, and he got his letter this morning, and he got his vaccination done today. So it is happening every day, more and more people over 80 being vaccinated. And the critical thing is to make sure that everybody can get it, that we're putting more supply into the areas that have got more to do. final thing I'd say on this point is that supply is the rate limiting factor. The NHS have brilliantly been able to deliver the amount of supply that that we have and that we have available, ready to go out, and that's the work that they've been doing. Next question is from Romilly Weeks at ITV.
Health Secretary, there will obviously be huge relief that the vaccine programme is going ahead at pace. But what do you say to those over 80s who still haven't been vaccinated, who are hearing that others younger than them are getting it first? And what is the reason that some areas are doing so much better than other areas? Is it because they're not getting sufficient supplies of the vaccine, or is it because they're less well organised?
Well, in terms of the differences in the rate of progress in different parts of the country, there's all sorts of reasons. It does take time to set up each of the sites, because each site has to be approved, because you want to make sure that, firstly, it's safe in terms of people going into the site and making sure that there's good infection control within the vaccination centre. And it's also got to be approved to make sure that the vaccine is properly reaches the arm properly. All of that does take a bit of time to set up. But the key thing about the goal that we've set by the 15th of February is that everybody in the top 4 groups will be offered a vaccine by then. Now, we want to, of course, get to care homes and those over 80 sooner than that. But that means that everybody in all of these groups can be assured that they'll be offered by the NHS that jab by the 15th of February, and we're on track to meet that target. I don't know whether Professor Powis wants to add something.
Yes, I can reassure you that in the NHS, it's our absolute priority to get vaccines to those people in those top priority groups as quickly as possible. And of course, that includes the over 80s, who are the very top priority, along with care home residents. And we are doing that as fast as we can throughout the country. Also, of course, at the same time, focusing on care home staff who look after residents and healthcare workers. And of course, this week, starting to move on to the over 70s. And so to do that, we are expanding the vaccine programme literally every week. Today, as you've heard, we opened 10 new large-scale vaccine centres. I had the privilege of being in Wembley this morning, just next to Wembley Stadium, to see the preparations that were being made by staff to open that centre this morning. And I can tell you from first-hand experience that they were incredibly enthusiastic and absolutely raring to go to get those jabs into those priority groups as quickly as is possible.
Thanks very much, Romilly. Next question is Ashish Joshi from Sky. Ashish.
Thank you very much. Health Secretary, you said recently it's up to us to have a debate as a nation about where we go next with the vaccine rollouts, identifying priority groups. How do you identify who needs a vaccine more urgently between a police officer, a shop worker, or a teacher? And the second question, can I have your response to Dr. Tedros from the World Health Organization, who said, as far as the global distribution of this vaccine is concerned, we're witnessing a catastrophic moral failure?
Thank you. So I'll ask Susan Hopkins to come in on the first part of that question. But it is essentially the clinical advice is to go through the top 4 groups and then through groups 5 to 9, which takes you to the over 50s. And then after that, it is essentially about protecting people as well as possible, according to essentially a judgment about who we think who should come next. That's why I think we should have a debate about it, because 99% of the deaths occur in the top 9 groups. I mentioned in my opening comments, 88% are covered in the top 4, 99% in the top 9. So after that, it really is about protecting against transmission and making sure that we can get life back to normal as much as possible. Susan.
Yeah, absolutely. So just to reiterate, those discussions happen with the Joint Committee for Vaccination and Immunisations. And we look at a range of figures there. So deaths, clearly, hospitalisations next, and then transmission. And I think one of the important points is that we're learning how well, and will continue to learn how well this vaccine will protect against transmission. And that knowledge will help inform the next decision-making process. Because clearly then you may target groups that are transmitting more than others or are out there and working. If it isn't working for transmission, then I think we need to continue to target the groups at the highest risk of hospitalisation, and those are the older age groups.
Thank you. And then on the second part of your question, I was in communication with Dr. Tedros over the weekend, and the UK is the world's biggest supporter, financial supporter, of the global programme to ensure access to vaccines in all countries in the world through organisations like CEPI and COVAX. So not only have we developed, in partnership with our scientists at Oxford and AstraZeneca, we've developed what is currently the most cost-effective vaccine that is available, the Oxford AstraZeneca vaccine. We've also put the most financial support into these international efforts to ensure everybody has access to vaccine. So I absolutely agree with Dr. Tedros on the importance of a global rollout, and we in the UK can be proud of what we are doing to support that happening financially. And I look forward to working with the World Health Organization and others, including in CEPI, COVAX and other organizations, to try to make sure that we get enough vaccine to be able to vaccinate the whole world, and certainly the whole world's adult population for which vaccines are now approved. And the next question is from Hugo G. from the Eye. Hugo.
Thank you. Question for the Secretary of State and Professor Powis. After a rapid acceleration in vaccine delivery over the course of last week, we've seen a significant dip in the figures from today and from yesterday. Why do fewer vaccines seem to be being administered at weekends? And what are you doing to ensure that the vaccination programme is providing a full 7-day service?
Well, the vaccine delivery is absolutely delivering a full 7-day service, and as you well know, we are prepared to go 24/7. There are movements in supply, and making sure that we get the supply into people's arms as fast as possible is absolutely critical. So I wouldn't read too much into an individual day's data. I think the best thing to do is look at the weekly averages, and as you say, you can see that going up and up fast.
Yes, well, each week we are when the supply comes through, increasing the number of jabs we get into people's arms, and that's throughout the weekend, and it's weekends as well. So the focus in the NHS is to absolutely make sure that this is a 7-day service and to get as many vaccines delivered to those priority groups as possible. So we will continue to increase the number of vaccinations as the supply comes through, and that will be throughout the week.
I mean, there's one other point to make, it's one that I've made many times, which is that supply is the rate-limiting factor. You know, the NHS is doing a brilliant job, but if you listen to the voices on the ground in the NHS, you hear people saying, "Give us more supply, and we'll jab it into more arms." And obviously, we're working with the manufacturers who are doing a brilliant job of getting it made and distributed as quickly as possible. So we're shoveling it out as fast as we can. Thanks, Hugo. The next question is from Jane Kirby at PA.
Good afternoon, Secretary of State. Can you confirm that it's your intention to start lifting restrictions in early March when immunity kicks in for those first top 4 priority groups who are currently getting the vaccine? And given that reopening schools is a national priority, is it your intention to reopen them fully around the same time? And how do you plan to alleviate the fears of teachers and parents who may be worried about transmission? And on the question of summer holidays, we're now vaccinating around 2 million people a week, which means at this rate, all adults should have received their first dose of the vaccine by the start of the school summer holidays. Can families now feel confident in booking a break for around then?
Well, on the summer holidays, I'm going to Cornwall, I've said before I think we're going to have a great British summer, but we've got a lot of work to do between now and then. And what we can do is see the line of sight to vaccinating everybody by September, and anything before that would be a bonus. As the Foreign Secretary said yesterday, we're driving this as fast as we possibly can. On the lifting of restrictions, I might ask Susan to comment on this as well, but we've got to watch the data. And the Prime Minister, when he brought in the national lockdown, set out 4 considerations. We've got to see the number of deaths coming down, and sadly we haven't seen that yet. We need to clearly see the pressure on the NHS reducing, and as you've just heard from Professor Powis, we are not seeing that yet. And then there's 2 other considerations, which is we must see the vaccination programme working, and the rollout is going really well, so that is clearly on track, but we've still got a massive effort, and we need to see the efficacy of the vaccine working in practice, saving lives, which we know that it will from the clinical trials, but I want to see that in actually happening on the ground. And then the 4th consideration is that there isn't some other new variant, in the same way that in December we discovered the new variant that caused so many difficulties and meant that the old 3-tiered system ceased to work. We monitor all the time for new variants, and as you know, we've taken very significant and rapid action to protect Britain from new variants that are spotted overseas. So those are the considerations, and we monitor them all of the time.
Yeah, absolutely. We monitor the data on a daily basis and review it with looking at when and what we think might be able to happen next. On the point in schools, we've always said that schools should be the last to close and first to open. But I think giving a more defined date than that is very difficult until we see what happens over the next few weeks.
Thanks very much indeed. And the final question is from Gareth Iacobucci at the BMJ.
Thank you very much, Health Secretary. Doctors, our readership, are fearful that they may be forced into some unimaginable decisions over which patients to treat because intensive care units are so full. Will the government introduce emergency legislation to protect those staff who are concerned that they may face legal action? They've worried that they might be sued for unlawful killing. These staff are working in challenging working conditions which are beyond their control. Can you say anything on that?
Well, thank you very much, Gareth. And I know that this is a very serious concern. And I obviously saw the letter that was written to me on this subject. And I'm very glad to say that we are not in a position where doctors have to make those sorts of choices. And I very much hope that we don't get in that situation and that everybody can get the treatment that they deserve. And so the clear advice that I have is that it is not necessary at this point to change the law on this matter. And obviously, having answered the question directly, I also want to add how much I admire and understand the strain on doctors who are having to work in incredibly difficult circumstances, and how grateful I am to them because those judgments weigh heavily. So, of course, I keep this under review and I take very seriously questions of this nature, but I am reassured that we do not have to change the law on this point. But obviously, I keep talking to the Chief Medical Officer and Professor Powis about subjects like this. Professor Powis.
Yes, well, as I said earlier, clearly the NHS is under huge amounts of pressure at the moment, and doctors and other clinicians are doing a magnificent job in coping with the number of patients with COVID that we are seeing, and I know they are providing the very best care. We have been planning for a potential wave such as this since the first wave last spring, so we were able to open more intensive care beds because we planned for that over the summer and the early autumn. And the priority all along has been to ensure that we can flex our capacity, we can open that extra capacity so that doctors and other clinicians can do what they always do, which is to make decisions which are in the best interests of the patients that they are treating in front of them. And that is what we will continue to do by increased capacity and if necessary, by mutual aid between hospitals. And one of the great things about a national health service is that our hospitals and other healthcare settings can work together as one. And if one hospital is under pressure, then another hospital close by, and very occasionally hospitals at a distance, can provide that assistance. So it's always possible to provide the care that patients require.
Thanks very much. I'll just end by saying this, that, you know, a very serious question from the BMJ about the very difficult situation that doctors would find themselves in were the NHS to be overwhelmed. That is not the situation now. And the data show that we are getting this under control, but that requires you to act by staying at home unless you have one of the reasons set out very clearly as to why you can leave, whether it's for exercise or if you can't work from home, or one of the other limited number of restrictions, and also how important it is to follow the basics of hands, face and space and the social distancing that is critical to stopping this virus pass from one person to another. So listening to the doctors who are working on the front line, and as Professor Powis has just set out, it's so important that we listen to those voices and everybody plays their part in getting this under control. Thank you very much indeed.